Well, I'm quite sure that we are all impressed and inspired by the excellent presentations we listened to. So the organizers did a marvelous job by bringing these particular experts together. And it shows again that there is really a lot going on in our field of interest, religion, spirituality, and meaning giving and mental health. From a Dutch perspective, I really need to add meaning giving or meaning making. In the Netherlands, it's no longer appropriate to speak and teach about religion and spirituality in relation to mental health without talking and teaching about meaning making, meaning giving, although I prefer meaning finding or meaning receiving. Well, I'll talk just a few moments, so don't worry. I have just one slide, but it's not available. Oh, there it is, but it's not. Oh, okay. So that's the combination of the logo, of course, of the European group and the picture of Amsterdam. Well, I think Hanneke Schaap set the stage. She reminded us that we need to be aware of, need to contact with what is going on in the field of mental health care. So an ecological approach is paramount nowadays. An ecological approach combines several recent developments: positive health, network medicine and care, and lifestyle medicine. For example, in the mental health institution where I practice, a lot of work has been done and is still going on lifestyle medicine. And yes, one of the aspects that is included in research and in therapy and in training is meaning. Meaning making, meaning giving. That's how it is called, not religion or spirituality. And one of the surprising things is that, or it might be not that surprising at all, that participants, I mean the consumers as they are called nowadays, are relieved, respond relieved. Finally, somebody asked me such questions. Nobody did before. That observation is, of course, not new, but it seems as if the developments in mental health care put together in an ecological approach create a more natural, I don't say neutral, I say natural, a more natural space or atmosphere which hasn't been available in that sense before, because professionals, mental health professionals, obviously experienced religion as topic as too restrictive for several reasons. And that seems to be changing in the Netherlands in mental health care. And it is this observation, I guess, that explains the optimism that Gerrit Klaas expressed in his introduction. But there is, of course, still a lot to ask and a lot to learn. For instance, we learned about what I call adapted therapies, such as presented by David Rosmarin, by Rania Awad and Harold Koenig. excellent examples of how to use spiritual issues in the context of a group therapy or a group training. And as far as I understood it, typical manual-like approaches. However, although they told us about the effectiveness of the programs, they didn't tell us much about what is happening, did they? It works, but how does it work? They didn't tell very much about that. But why bother? If it works, it works. On a psychological level, we take the general therapeutic factors for granted. For example, in groups, we are aware of installing hope, universality, cohesion as general therapeutic factors. So what we assume when we put it in this way is that there is a certain content, a spiritual content, a spiritual program, even adapted to the 5 main religious traditions, including sermons. There is this spiritual content, and there is a therapeutic process, for instance, in a group. However, putting it that way might in fact cause a false dilemma, a false dichotomy, as if it would be possible to separate these two, the content and the process. And I guess it is a false dichotomy. What Hanneke told about shame and Helena about existential loneliness and Dr. Langle about inner and outer dialogue showed that these phenomena are psychological and existential experiences, and as such these experiences are embedded in relational networks. That means, from the perspective of network mental health, that there is not just a content, because there is always the relational embeddedness, which is not an abstractum, but a presence. So the ecological approach invites us to rethink shame, as Hanneke showed us, and to rethink the content and process dilemma, but also to rethink all other topics we discussed. And by doing that, we will be able to connect with and to contribute to these developments in mental health care. To add just one thing, moral injury, as Koenig told about, moral injury isn't only an individual tragedy. It happens in a professional group. And that professional group is part of a social community. And that social community is embedded in society at large. That means that sooner or later, there is that issue of health advocacy. Health advocacy. I think that health advocacy is an indispensable part of an ecological existential approach. And yes, certain religious and spiritual themes, such as forgiveness and flourishing, belong to the domain of public health. We started with shame and we end with pride. There is a lot to be proud of. For the last 20, 25 years, we managed to develop in the Netherlands, we managed to develop an academic infrastructure for the study of religion and spirituality. The KSGV, the Expertise Center for Religion and Mental Health, and again, Gerrit Glas, made a major contribution in these accomplishments. Nowadays, there are academic chairs related to mental health and public health at nearly all Dutch universities. And today, look around, you have seen how many young people from several disciplines have become interested in this field of inquiry. And not only that, they are interested in doing research. You have seen the posters, you have listened to them during the symposia. And that is the merit, among others, that's the merit of Hanneke Schaap and Arjan Braam, who managed to get a group of researchers on their feet. And I would say that's one of the main reasons to be optimistic. Also because of the development of international collaboration in research networks, which is of course stimulated by conferences such as the one you are actually in. Finally, making oneself present and participating, Professor Lengle said. That is real commitment, he added. I have seen, we have all seen and experienced a lot of commitment during these days. And that is a lot of reason to be grateful. Thank you very much.